lovely little timeline. We should be done by 11 o'clock. A little earlier if you opt to not participate in the study portion. So a little about me. This is my family. I share a blended family with my significant other, Josh. This is Liam and Dominic and Kaden. They are awesome, but having 3 boys is a lot, so they keep me on my toes.
But they did help carry the donuts in this morning, I heard, so we all love them already, right?
And when you get your studies, they also helped put stickers on the studies. So if you get some that are real wally wonky, it was the 7-year-old. They wanted to help, so. In my spare time, I like to spend time with them, obviously, because they're my #1 priority. I like to travel, craft, and make TikTok videos about my GLP-1 weight loss journey. So, that's enough about me. Until I tell you about my role here at the Guidance Center. So, I started at the Guidance Center back in 2010 when I was fresh out of my undergraduate degree with my psychology degree from Washburn University. And in that time, I worked YPP, early childhood. I did some on-call attendant care work with adults. And I also worked as a targeted case manager for early childhood. So I've done a little bit of everything at the Guidance Center in community-based services. I went back to grad school in the fall of 2022 at Park to get my master's in social work, obviously. And I've done both of my practicums at TGC. Normally practicums, you have to do them at 2 separate locations, but Park has been wonderful and let me keep them here in my safe place. So I am very thankful and grateful that the Guidance Center has allowed me to complete both my practicums here and have loved both my practicum last year and my practicum this year. So these are our objectives for today. First thing we're gonna do is obviously define moral injury. We're gonna identify the causes of moral injury in mental health workers, describe psychological and emotional impact on mental health workers, highlight the consequences of professional practice and patient care, discuss the role of organizational and systemic factors in moral injury, explore coping strategies and support systems for mental health workers, discuss the need for increased awareness and education, and promote advocacy for structural change. And I apologize everyone in advance, I am not a good public speaker, and I will do my best to not read off of the PowerPoint. But when I started putting this together, Rachel asked me to include this slide, why I chose moral injury. My practicum last year, I focused on self-care and the importance of self-care in case managers especially, because I saw a lot of need and burnout on our team. And so taking care of us as social workers and as people here working at the Guidance Center in direct service has really been a passion of mine. And I went to Dr. Drew for supervision with him. I do an additional supervision with him. He's been my mentor this year. And I was like, I have no idea what to do. And he was like, well, what are your interests? And I was like, I really just want to talk about self-care more and burnout. And he actually introduced me to the topic of moral injury prior to that, I had no idea what moral injury was, nor had I ever heard of it. But as soon as he started talking about it, it all made such sense to me and clicked, and I was like, this is definitely a topic that I could get behind being passionate about, and have done oodles of research to learn more about it. So what is moral injury? Moral injury doesn't have one specific definition. There are multiple definitions across the research, but I put down 4 of the definitions that I found in my research. But when it comes down to it, moral injury is what you suffer as a consequence of your work. And I know that might sound like a little scary, but we all experience emotional and ethical dilemmas in our job every day, and we deal with crises that are really heavy, and those things tend to wear on us, especially if we have to make a decision in treatment that goes against what we believe is the best option. So, what are the causes of moral injury? Kind of like I said, facing specific situations that can lead to moral injury in mental health settings, witnessing ethical dilemmas, witnessing harm, feeling powerless in the face of systemic issues. So back to, the work you do every day with kids and adults, it's very stressful work. And sometimes that stressful work we carry with us. Consequences of moral injury on the professional practice. This is, we have that heavy stuff. How does that affect us in our work every day? So burnout and mental health issues is like the #1 thing I found across all of my research. And burnout is something that social work is known for in general, as well as all mental health fields. And I apologize that I tend to lead towards social work when I speak, but it's because it's been ingrained in my brain for the last 3 years. So, does anybody want to give me a definition of burnout? There you go, Amanda.
Lack of enjoyment, not having good boundaries, just overall fatigue.
Yes. So it's those things that we also experience: depression, anxiety, post-traumatic stress disorder. Those can all take a toll on our physical exhaustion and emotional numbness that we can get when working with clients. Because if you have a client every day telling you certain things, and eventually you're just like, okay, that doesn't shock me anymore, that doesn't shock me anymore. That's that emotional numbness setting in. And it's also the diminished ability to cope with those stressors of the profession. So when we get burnt out, are we taking care of ourselves? Are we stopping to do self-care? Are we taking care of our burnout, or are we just pushing on through our burnout? Decreased job satisfaction. If you're burnt out and you are experiencing moral injury, do you want to go to work every day? Probably not. It can be a struggle just to get out of bed because you are dreading your day already. So you're gonna feel less motivated and more cynical about your work in general, like, how's your day going? Most of the time, by the end of a day, a lot of us are like, it was a rough day, especially from Miss Hannah yesterday.
Definitely played mom this entire time you're talking about.
I could see how Miss Hannah probably suffered some moral injury yesterday in particular. And as I was preparing for this project, I decided I was gonna pick on her if she was here to share her experience yesterday. So other consequences of your practice on moral injury on your practice, I apologize. Impaired decision making. When you're not clear-minded and focused on your work 100%, you're not going to make the best decisions for, you know, anything in general, but it can cause indecisiveness, hesitation, guilt, and it can undermine your ability to provide the optimal care. And when it comes down to it, what are we here to do with our clients or person receiving services? We're here to give them the optimal experience and give them the best care possible. It can also increase absenteeism or attrition. More severe cases can lead to high levels of absenteeism. Like I said, if you're feeling this way, you don't wanna go to work, so what are you gonna do? I'm not feeling good today, I'm not gonna be in. Because you're trying to take care of yourself, but you're probably not doing it in a way that is necessarily a healthy way to cope with it, but you're avoiding your work. Moral disengagement. Healthcare workers may begin to disengage morally, detaching themselves from the emotional aspects of patient care in order to cope with the overwhelming ethical dilemmas they face. This may result in depersonalization and decrease their empathy towards patients and their families. When you're feeling this way, it's hard for you to be like, Sierra, I'm so sorry that you're going through that, when you're in your mind thinking, you don't even know what I heard today and what I've been through today. It's hard for you to be, you know, engaged, and is that really optimal care? Not really. So the consequences of moral injury on patient care. Decreased quality of care. In my opinion, this is one of the most important aspects of moral injury, because again, we're trying to provide our clients the best quality of care that we can, and we need to be at our best in order to provide that quality of care. You can't be as connected to your clients if you're feeling this way. You know, it's hard to build relationships with people when you've got your own things going on in your head. Communication breakdown. You may struggle to express yourselves clearly or engage in difficult conversations with clients in general. Like, I can't have a difficult conversation with you if I'm up here constantly thinking about everything that's going on and trying to cope with my own things while helping you cope with yours. Reduce teamwork and collaboration, especially in healthcare workers. I don't think this is in the slides, but in my research I found that a lot of moral injury was suffered during COVID, especially in the healthcare field, because people were constantly having to make the decision, who do I give this ventilator to? Do I give this ventilator to this person? Do I give this ventilator to that person? Of course, in your heart, you wanna save both people, but you have one ventilator. And so you have to give the ventilator to the person that needs it the most, knowing that the person without that ventilator is probably gonna die. And that collaboration in healthcare, you've got doctors telling you, okay, this patient needs it more, maybe you personally think, I really think that person needs it more. So that's gonna break down that communication. Compromise patient safety. If you are not vigilant and attention to detail, you are more likely to make mistakes. When you're off your game, you know, or in stressful situations, it's not easy to jump in with a clear head and go, okay, what's the ethical way to handle this situation? My gut says this, job says this, which am I gonna do? Patient psychological well-being. If a healthcare professional's distress affects the ability to communicate empathetic or engage with patients meaningfully, it can contribute to the patient's own stress or emotional distress. Because our patients, as we care about them appropriately without crossing too many boundaries, but you know, you do care about your patients. If you didn't care about your patients, you wouldn't be here. And our patients grow to care about us as providers too. And if they see that we are really struggling, that can increase their own struggling as well. And that is not optimal care either. And although I think that's great that you have that relationship with your clients, that they care when you're upset, it's our job to kind of hide those feelings and not let them see, you know, that we are feeling certain ways. And in best practice, we wouldn't have those feelings and we would not have to hide anything. So organizational culture and values. So if your personal values conflict with the place that you're working, it makes it really hard to make decisions and not have an internal conflict about it. So if we're prioritizing financial efficiency over patient care, you're left with the pit of your stomach like, I'm not giving my client the best care possible. And that's one of my personal, like, I wanna give my clients the best me every time I see them. And if I'm worried about what someone's telling me to do differently in order to save $1, that's gonna create more conflict for you. Lack of moral support. Organizational structures that don't provide adequate moral or emotional support can exacerbate these feelings of moral injury. If you're working for a place that just doesn't care how you're feeling, that's gonna create animosity, that's gonna create just a really terrible work environment for you. And we want that support from our leadership, from our organization, knowing that our organization is looking out for us as people and not just numbers. Inequitable systems. When we feel that the organization systems are inherently unfair or unequal, you may be placed in situations where you're forced to act in ways that violate your moral compass. Because we always want to feel that we're being treated fairly. Nobody likes to be treated unfairly. And if you feel like you're being treated unfairly, it is more likely that you're not going to make the best decisions. And stand by your morals, because your morals might get shoved down there, because you're like, I don't really care, I'm tired of being treated unfairly, I'm gonna do it this way because this is what I wanna do, and obviously, that is not the best quality care. Resource limitations. In organizations such as hospital, military, or law enforcement, systemic factors like resource shortages can force individuals to make impossible decisions or take actions that go against their own values. One thing I recently have seen that I have been worried about are my coworkers that are very adamant about not giving out their personal cell phone number. And they use Office at Hand, and Office at Hand has not been working. And so they had to make the decision, do I give out my personal phone number to contact my clients? Or how do I handle this situation? And I felt like that was something that was going to cause some issues for some of my team members in particular. I personally, you can Google my phone number and find it real quick. I don't care if my clients know my phone number. But I do understand that boundary. I don't want my clients having my phone number. And so that was a resource limitation. Now the guidance center is at no fault because Office at Hand wasn't working. But if we lived in a perfect world, we'd all have work cell phones, right? Lack of ethical leadership. If you have a supervisor that is not ethical, how is that going to help you align with your personal ethics? Because you are all ethical people, I'm assuming. And if you're not, somebody's got their eye on you. But if you are getting unclear ethical guidelines given to you, it makes it harder for you to figure out the black and white situation, the gray situations, because not every situation is black and white. Failure to address harm. When an organization does not take responsibility for harmful actions, either by employees or organizations itself, it can increase moral injury felt by those affected or by witnessing these actions. We want people to admit when we've been wronged or we've been put in a tough situation. We want, that warm, cuddly feeling knowing that our supervisor's got our back and is there to support us. And when we don't have that, it can definitely create not only a poor work environment, but more moral injury. So organizational priorities and decisions. I said profits over people earlier. In some cases, organizational priorities, and these kind of go together. If you feel replaceable at work, then it makes it a little harder to go to work every day. You don't feel as good about the work that you're doing because you feel like you're just a number, you're just a spot holder, that Donovan can just be replaced by any other person and it's no big deal, when it is a big deal because he has great relationships with his clients and they adore him and wanna keep working with him. And so we want him to stay here. And when you don't feel that your organization has your back and that you're just another person that is easily replaceable, that creates that feeling. Systematic trauma or chronic exposure. Exposure to repeated harm is gonna make this worse. And if you're not taking care of the issue, individuals exposed to situations where they cannot prevent harm or suffering, leading to cumulative moral injury over time, is not healthy at all. And if an organization isn't taking steps to fix that or address those issues, it's gonna create more harm. And inadequate aftercare. Again, organizational places may fail to provide adequate mental health support. I know as mental health workers, it's not always our priority to take care of our own mental health. And sometimes it might feel like our organization is failing to treat our mental health too. And that is so important that your mental health gets treated. For working with people in general, I personally think everybody should be in therapy because we all have problems, and if we're dealing with other people's problems, we need someone to talk to about that. So increased awareness and education is so important. The reason why I chose this topic is because I'd never heard of it. I was like, at first when Dr. Drew he mentioned several things, and I'm not gonna lie, I'm a little ADHD, so he can say several things and one thing sticks out and the rest just fly right out the window. But I clung on to it because I was like, if I don't know about this and I'm in grad school, how many of our people here at the Guidance Center know about moral injury, the fact that they might be suffering from moral injury and don't even realize it. So it is really important that we train people on what this is, what to look out for, how to take care of it.
It seems like the big difference, and I hadn't heard of this until you brought it to my attention either, is like self-care like puts the onus on the individual of like, if you're getting burnt out, it's your own fault. If you're getting burnt out, you need to fix it and figure it out without looking at the environment that they're in or like what's around them or what the organizational support looks like.
That's a great point, and I should have, mentioned that. But it is truly, self-care is put on you. It's your responsibility to take care of yourself. Moral injury is more on the organization to take care of you, to protect you. And we need to normalize this experience. It's not like we don't experience stressful situations every day, that we don't have ethical dilemmas every single day. It shouldn't be stigmatized or anything like that. Just like any other mental health issues, we always are telling our clients, yes, you suffer from depression, but you are not depression. We put people, person-centered care first, but then are we putting person-centered care first here? And we need to make it to where everyone feels that we need this. So, what can we do to build resilience and compassion work environment? Trainings on ethical decision making are important. So it might seem like that ethics training that you have to take every year is like a little bit cumbersome, but it's important that we do those trainings and revamp those trainings every year so you're not hearing the same thing. And it can help minimize the risk of moral injury. And creating a culture of compassion and accountability. I nobody is coming to you every day and saying, are you taking self-care? Are you taking care of yourself? Are you taking care of yourself? You know, but there are, and I see changes currently going on, especially in the community-based services team of a certain supervisor who's always like, make sure you're doing self-care. Make sure you're taking time for yourself. If you're sick, go home. So those are great things and great steps, but we need everybody on that page. We need everybody to have that sense of take care of yourself. Have an open dialogue to where we are comfortable going to our supervisors and saying, here's what's going on, without worry that they're gonna be questioning our ability to do our job. So what happens when it's left untreated? I think we have covered a lot of this. Burnout and compassion fatigue, increased anxiety and depression, diminished professional efficacy, difficulty with emotion regulation. If you are untreated for moral injury, you're gonna have a harder time regulating your own emotions. And I know that most of us are teaching our clients to regulate their own emotions. And how can we teach someone to regulate their emotions when we can't even do it ourselves right now? Strained relationships. If you're stressed out at work, you're feeling these feelings, how's life gonna be like when you come home to your family? Are you able to leave it at the door? If you're really suffering, probably not. You're gonna bring it home. You know, the kick the dog theory, someone's gotta get it. Impaired self-worth. When you're feeling these terrible feelings of moral injury, you start to question yourself. Am I doing a good job? What am I doing wrong? All those things that run through our heads when we're feeling not at the top of our game. And of course, the ethical and professional dilemmas. So, how do we treat moral injury? Well, therapy is a great start. So, I have highlighted 3 types of therapy that I read in the research that really help treat moral injury. Trauma-focused therapy. We've experienced a trauma. Obviously, a trauma-focused therapy is gonna help us get through that. Narrative therapy. This approach encourages people to express their experiences and create new meanings for those experiences. That's gonna help you talk it out, figure out how to better label it in your head. Compassion-focused therapy. This therapy helps individuals to develop self-compassion, reduce feelings of shame and guilt, which are often central to moral injury. Peer support and supervision. Peer support groups are lovely, and sometimes we create our own self-support groups within the office where you're talking about the things that are stressing you out. And those really are healthy ways to cope with some of the things that you're going through. And if you're experiencing moral injury, and maybe someone in that group will know what moral injury is, and they're like, you need to get help for that. You need to get help for that. I'm not trying to call anybody out, but clinical supervision. We all have supervision with our supervisor. That's a great time to talk about these things. XYZ clients. Well, this semester I've been blessed to have been given 3 sets of supervision. I have my field supervision with Rachel, I have my supervision with Sam, my supervisor for my job, and I have supervision with Dr. Drew. And one day he told me, you know what? Some days supervision just feels like therapy. And that really stuck with me because I was struggling and I needed somewhere safe to come vent to, and I didn't know which direction I felt most comfortable going to vent to, and he happened to be the place that I ended up that morning. Mentorship. Having a mentor who has been through similar situations can be comforting and reassuring. A mentor can often offer practical advice and emotional support. So if someone's been through what you're going through, obviously they understand. They maybe have resources that you don't know about. Self-care and resilience building. Mindfulness meditation. I am very focused on mindfulness, especially with my clients and mindfulness practices, but I don't always think, maybe I need to do more of this myself. So meditation, breathing exercises, grounding techniques can help you regulate your emotional responses and reduce anxiety and stress. A lot of us know this information, but it's a matter of putting it into practice. Physical exercise is also good. Now, I can't say that I'm gonna tell you, go out and run a mile every day, cause that's not how I'm gonna do my self-care. But for some people, it's a great option. And it has been shown to improve mood and overall well-being, which can support mental health professionals in managing the emotional toll of their work. Personally, I don't believe that research. I know it's there. Developing healthy boundaries. It is really easy to slowly let the boundaries go a little bit more and a little bit more. Like I said about the, keeping our cell phone number. If we wanna keep our cell phone number to ourselves, that is a boundary that you should not have to cross. Stick to your boundaries. Stick to your moral boundaries. If you cannot stick to your moral boundaries, seek help for that. What can I do to better set up boundaries? What can I do to make sure I'm taking my lunch break? I don't know how many people don't take a lunch break. Officially, they're in their car eating in between clients, they're eating with their clients. It's important to take that 30-minute lunch break. Eat at your desk. Now, is it always possible? Maybe not. But we need to work towards finding ways to make it possible. So what can I do to help myself? So I have talked a lot about the importance of self-care, therapy, and mentioned that I think everyone should be in therapy. And one thing that I have really looked into is the Employee Assistance Program. We have it here at the Guidance Center. If you don't delete your email like me, you just Google or search your email for Lucid, and it will pop up with the information for our Employee Assistance Program. And they offer services to reduce stress, cope after crisis, focus at work, lead others, navigate the legal system, reduce debt, live healthier lives, support and improve relationships, and being resilient. That all sounds great, but how often are we using it? Well, it's a pain to use that stuff. No, there's so many ways to reach out to them. You can go to their website, you can call their 1-800 number, and you can even download their app. And when you download their app, there's actually a text messaging service that you can utilize with that. So they really have made it accessible, and I believe it's 12 sessions of therapy that they will provide for free to you. And who doesn't love something that's free? Cause then you're not paying your copay to go see a therapist, and that's why I chose to really highlight this, is because I'm thinking to myself, if I'm gonna get help, I'm gonna get help in the cheapest way possible, the one that doesn't take the most work, and that I can access easily. And so I found this to just really be something that I don't think enough employees are probably taking advantage of. And like I said, you can get therapy face to face, you can get it online, you can get it via the telephone, and in the moment chat. So you have no excuse to be like, well, I can't leave the office. Do a telehealth visit on your lunch break. Take an extended lunch break if you have to. Flex your day a little bit. This job is great at offering us the ability to flex our time for most positions. So, why did I want to tell you all about this? It all boils down to, this is what is called my ISP project, similar to like a thesis or a capstone. And I am looking to investigate how many of us here at the Guidance Center are suffering from moral injury. Because I feel like if I'm able to captivate how many people are suffering from moral injury, I can take that data, not only write my paper, which will help me graduate, but I can take that to leadership and be like, look how many people are suffering from this. What else can we do to help? And I really wanna be an advocate for everybody here. And the one way I can do that is by testing everyone for moral injury. So, if you are interested in participating in this study, you're gonna get a packet like this. It tells you, before you agree to participate in this study, it's important that you read and understand the procedures it involves. The investigator will also explain the project with you in detail, as I just did. If you have any questions about the study or your role in it, be sure to ask the investigator. If you have more questions later, I am more than happy to answer them for you. You can contact me on my cell phone, by call or text, because nobody likes to call anybody anymore. Or you can also email me. And I put my personal email, but you can also email me here through the TPC email. What can I expect if I participate? If you decide to participate in this study, you'll be asked to fill out 2 surveys. The first one is called the Moral Injury and Distress Scale, the MDIS. It is a psychological tool designed to measure the impact of moral injury and distress. This is a more overall encompassing of moral injury. The second questionnaire is the measure of moral distress for healthcare professionals. So this really focuses on people taking care of people and will give a good measure of how your moral injury is in work in general. Both are not long. I will show you. The measure for moral distress in healthcare professionals is just a little 3-page survey. It's a Likert survey, so 1 to 5, 1 to 4, or 0 to 4, I apologize, 0 to 4. Shouldn't take you long. And then the other one is also, it's 3 pages, but the front one's just the fancy information. So 18 questions that you have to answer. Who will have access to your personal information? So every single packet is numbered. Participant 1, this is where I'm probably gonna get off topic with my slides. These are informed consents. Every study that you are a participant in, you should always sign a informed consent. So your name is on the informed consent, and I'm asking for your email, and your number is right here. This is the only piece of identifying information that you're gonna have, and the only person that will have access to this information is me. Now the rest of it, I'm going to share my results with leadership, or the executive team. We haven't decided with Ashley for sure which way that's gonna go. But I will be happy to provide them with the surveys, but your name will not be attached to the survey at all. Your participant number will be, and I will under no circumstances give your participant number to the guidance center when I offer them that information. You will not be identified a name in any publication that results from this research, and all information from this study will be destroyed 3 years after the study ends. Cause I don't wanna keep this paperwork, I don't. What are the benefits? Now, personally, you're not getting a lot of benefit directly from taking my survey, although I do give you my utmost appreciation for participation. But in the end, this information might be helpful in developing future programs that promote staff health. And that is my ultimate goal from collecting the data. Procedures, if you are choosing to participate, you'll be given a informed consent, like I said. You will answer the 2 surveys, and if you are identified to have high levels of moral injury, I am personally going to follow up with you with additional resources, because I feel like that is important. Now, that follow-up is probably, when I first started this project, I was like, I'm gonna go meet with them and talk with them, and then, let's be real, I'm a graduate student, I work full-time, and I have 2 kids. I probably don't have time for all that. So it's probably gonna be an email with information, and if you have questions, email them back. So it's gonna be a pretty easy follow-up to get the information, and it might include me throwing 2 more surveys in your box at the end to see if your moral injury scores have increased, decreased since the first study. These my sources. I know you guys are all super interested in them. They're great. And they are in the packet, and if you can't read it, this will be available to you, later. I do wanna say a special thank you to Rachel Wolf, who is my field advisor. She made all of this possible. When I first started this project, I said, hey, Dr. Drew, can I come to your team and just present to your team? Because last year I just presented to my team and I feel like that would be cheating. And he's like, yeah, sure, that sounds great. And then I went to Rachel and she was like, oh no, here, let's make this a training. This is great, I love it. And she's been nothing but optimistic about it, even when I was like, I just wanted to present to Drew's team. I don't like talking in front of people. But I also wanna thank Dr. Drew for being my mentor this year. He doesn't have to take on additional people on his team to provide mentorship to, and he hasn't been invaluable to my learning this year of graduate school. And I also wanna thank Sam and Sierra for letting me skip team meetings so I could give this presentation. Because team meetings from 9:30 to 10:30. And also, I wanna thank you for participating in today's seminar, and anyone who chooses to complete the surveys following the seminar. I appreciate every participant in today's study, I really do. I know it's not always comfortable sharing your personal information with people, and I know how hard it is, but I do wanna make this study available to everyone after I have the information. So I'm thinking, I haven't really thrown this idea out too much, but writing up a little blurb maybe for the employee newsletter so you can see, hey, that's what came of that training that I did. Or I might just send an email out to everyone that came today and be like, hey, here's what I got. So it could look in many different things. So with that, I wanna thank you for participating. And if you do not want to participate, you are more than welcome to leave. But if you do want to participate, I will be passing out surveys now. Thank you. Yeah, that'd be great.